Alright everyone, Dr. William here, and today we're diving deep into something super important, but often overlooked, your kidneys. You see, when we talk about health, everyone's buzzing about hearts, brains, and even guts, but these unsung heroes, your kidneys, often get left out of the conversation. And that's a huge problem, because kidney disease? It's often called the silent killer for a reason. You won't hear a peep, feel a twitch, or see a big red warning sign until, well, things are already pretty far along. And what makes it even more dangerous is that there's a ton of misinformation out there, myths that people genuinely believe, which can lead to critical delays in getting the right diagnosis and the right treatment. So listen up. In this video, we're going to tackle some of the most dangerous and common myths about kidney health that are still floating around. We're talking about beliefs that can seriously put your kidneys at risk and potentially shorten your lifespan. My goal today is to arm you with the truth, to empower you with accurate, evidence-based information so you can protect these vital organs. Because the more you know, the better equipped you are to keep your kidneys happy and healthy. Let's get started and bust some myths. Alright team, let's jump right into myth 1. And trust me, this one is a big problem. It's the belief that you'll just know if your kidneys are failing, that they'll give you clear, unmistakable warning signs. Folks, this couldn't be further from the truth, and it's probably the most dangerous misconception out there. The reality is early-stage kidney disease is a master of disguise. It often has no noticeable symptoms whatsoever. Think about it. Your kidneys are incredibly resilient, working overtime to compensate for damage, so you won't feel a thing even if they're struggling. By the time you start noticing those classic red flags, like swelling in your ankles, persistent fatigue that just won't quit, or changes in how often you're heading to the bathroom, your kidney function may have already taken a significant hit. We're talking serious decline. This is why waiting for symptoms is a risky game to play. Instead, especially if you have any risk factors, and we'll talk more about those later, regular checkups with your doctor, including simple blood and urine tests, are absolutely non-negotiable. They're your best defense for catching any issues early, before they become a full-blown crisis. Don't wait for your body to scream for help. Be proactive and get those kidneys checked. Alright, let's tackle myth 2, which I hear all the time. Drinking tons of water flushes your kidneys clean. Now, I get it, hydration is king. And yes, staying adequately hydrated is absolutely crucial for your overall health, including kidney function. Your kidneys need water to do their job of filtering waste and producing urine. But here's where the myth gets it wrong. The idea that chugging gallons and gallons of water beyond what your body actually needs somehow gives your kidneys an extra super flush or cleans them out better. That's just not how it works, and honestly, it can even be counterproductive. In fact, going overboard with water intake can actually be dangerous. We're talking about a condition called hyponatremia, which is when your blood sodium levels drop dangerously low because you've diluted them too much. This can lead to serious health issues, from nausea and headaches to confusion, seizures, and in extreme cases, even be life-threatening. Your body has an amazing internal thermostat, so the best approach is to listen to your body's thirst cues. Drink when you're thirsty, and aim for consistent, moderate hydration throughout the day. Unless your doctor has specifically told you to drink more for a particular condition, don't feel pressured to force down excessive amounts of water. Your kidneys are smart, and they don't need to be power washed. Alright, switching gears to myth 3. And this is a big one that can genuinely cause harm. Herbal supplements are always safe for kidney health, and they can even cure kidney disease. I get it, the word natural sounds appealing, right? We often associate it with being gentle and beneficial. But folks, this is a dangerous misconception. Just because something comes from a plant or is labeled herbal absolutely does not mean it's safe for your kidneys or for your body in general. In fact, many herbal supplements contain compounds that can be directly toxic to your kidneys, especially if you're already dealing with an underlying kidney condition. Think about it. These aren't regulated like prescription medications, so you often don't know the exact dosage, purity, or even all the ingredients. They can interact negatively with medications you're already taking, making your prescriptions less effective or even increasing their side effects. And the idea that they can cure kidney disease? That's just false hope, and it can lead people to delay or abandon proven medical treatments, which is incredibly risky. My professional advice here is clear. Always, and I mean always, consult your doctor before taking any new supplement, particularly if you have kidney issues or are on any medications. Don't risk your kidney health on unverified claims. Your kidneys are too important for guesswork. Alright, let's bust myth 4, which often brings a lot of unnecessary anxiety. Kidney stones mean you have kidney disease, or you're definitely on the path to kidney failure. Now let's be super clear. Kidney stones are, for many people, absolutely agonizing. If you've ever had one, you know the pain is no joke. And yes, they form in your kidneys when certain minerals and salts crystallize. But here's the crucial distinction. While having a history of kidney stones might indicate you're prone to forming them again, it does not automatically mean you have chronic kidney disease, CKD, or that your kidneys are failing. These are two very different conditions, although they can sometimes overlap. So don't panic if you've passed a stone or two. However, and this is important if you're experiencing recurrent kidney stones, meaning they keep coming back, that's a different story. Frequent stones can sometimes be a red flag for underlying metabolic issues in your body that need to be investigated. These could be things like imbalances in calcium, oxalate, or uric acid that your doctor can help identify and manage. Getting to the root cause of recurrent stones is important not just for pain management, but also to ensure there aren't any long-term consequences for your kidney health. So, while a single stone doesn't spell kidney failure, don't ignore repeated occurrences. Always have them checked out. Alright, let's smash myth 5, and this is one I hear all the time. Only older people get kidney disease. It's just an elderly illness. And folks, this is a dangerous misconception that can lead to complacency, especially among younger individuals. While it's true that the risk of kidney disease does increase as we age, our bodies just naturally accumulate more wear and tear. Kidney disease is absolutely not exclusive to seniors. It can, and sadly does, affect anyone at any age, from toddlers to teenagers and young adults in the prime of their lives. Think about it. Conditions like diabetes and high blood pressure, which are the leading causes of kidney damage, aren't just limited to older populations anymore. We're seeing them impact younger demographics more and more due to lifestyle factors. Plus, there are other causes like genetic factors, certain autoimmune diseases, and even some congenital conditions that can lead to kidney issues regardless of how many candles are on your birthday cake. What this means is that healthy habits and regular checkups aren't just for your grandparents. They're crucial for everyone at every stage of life to protect these vital organs. So, if you're young and think you're immune, think again. Alright, let's tackle myth 6, and this one can create a lot of confusion and even false hope. Dialysis cures kidney disease, and it's the only option if your kidneys fail. Now, while dialysis is an absolutely life-sustaining treatment, and thank goodness we have it, it's crucial to understand what it actually does. When your kidneys fail, they can no longer filter waste products and excess fluid from your blood. Dialysis steps in as an artificial kidney, using a machine to perform these vital functions. It's a lifesaver, but it's important to be clear. Dialysis does not cure kidney disease. It's a replacement therapy, meaning it helps your body do what your kidneys can no longer do. But it doesn't fix the underlying problem that caused the kidney failure. And here's another key point. It's definitely not the only option for end-stage kidney failure. While dialysis is a common and effective treatment, kidney transplantation is often a preferred alternative for many eligible patients. A successful kidney transplant can offer a significantly better quality of life compared to being on long-term dialysis, providing more freedom and often fewer dietary restrictions. So, if you or a loved one is facing kidney failure, understand that while dialysis is a critical tool, it's not a cure, and exploring all your treatment options, including transplantation, with your medical team is absolutely essential. Don't limit your understanding to just one path. Alright team, let's talk about myth 7, and this is a big one, especially if you're into fitness or building muscle. A high-protein diet is always good for your kidneys, especially for muscle building. Look, I get it. Protein is absolutely essential. It's the building block for muscles, enzymes, and so much more. And for many healthy individuals, a moderate to high protein intake can be beneficial. But here's the critical nuance. Excessive protein intake, particularly from animal sources, can put a significant strain on your kidneys, especially if those kidneys are already working overtime or are compromised in any way. Think of your kidneys like little filters working tirelessly to process waste products, including those that come from protein metabolism. If you're constantly flooding them with more protein than they can efficiently handle, it's like asking them to run a marathon every single day without a break. For individuals who already have even mild kidney dysfunction or chronic kidney disease, CKD, uncontrolled high protein intake can actually accelerate kidney damage. This is why for people with kidney issues, protein intake often needs to be carefully managed and sometimes restricted. So, before you load up on that extra scoop of protein powder, it's crucial to consult a registered dietitian or your doctor. They can help you determine the appropriate and safe protein levels for your specific needs, ensuring you're supporting your health without unknowingly stressing your kidneys. Alright, let's demolish myth 8, which can give people a false sense of security. If you don't have high blood pressure or diabetes, your kidneys are absolutely fine. Now, it's absolutely true that high blood pressure and diabetes are the two biggest culprits when it comes to kidney disease. They're the heavyweight champions of kidney damage, no doubt about it. We see them causing the vast majority of chronic kidney disease cases worldwide. So, yes, managing these two conditions diligently is paramount for kidney health. But here's the crucial point. They are not the only reasons your kidneys might be struggling. There's a whole host of other risk factors that can silently chip away at your kidney function. We're talking about things like having a family history of kidney disease, which means genetics can play a role. Obesity is another major independent risk factor that puts stress on your kidneys. Certain autoimmune diseases like lupus or even recurrent kidney infections can slowly but surely cause damage. And let's not forget the long-term, unmonitored use of certain medications, particularly over-the-counter pain relievers like NSAIDs, which we'll definitely talk more about later. So, even if your blood pressure and blood sugar are perfectly in check, it's vital to be aware of these other risk factors and discuss them with your doctor. Don't assume your kidneys are invincible just because you've dodged the two biggest bullets. Alright, let's tackle myth 9, and this one can be incredibly disheartening and even dangerous if believed. Once you have kidney damage, there's absolutely nothing you can do about it. This myth, unfortunately, leads to a sense of hopelessness and can stop people from taking vital steps to protect their remaining kidney function. Let me be unequivocally clear. While some severe kidney damage can be irreversible, the idea that all kidney damage is a lost cause is simply not true. In reality, early diagnosis and proactive management are absolute game changers. If we catch kidney issues early, even if there's some damage, we can often significantly slow down its progression and even prevent further deterioration. We're talking about crucial interventions here, making targeted lifestyle modifications, things like dietary changes tailored to kidney health, regular exercise, and maintaining a healthy weight. Then there are medications that can help control blood pressure, manage blood sugar for diabetics, and even specific drugs designed to protect kidney function. So, if you've been told you have kidney damage, don't throw in the towel. Partner with your doctor, stay vigilant, and know that you can take powerful steps to preserve the kidney function you have and improve your long-term health. Knowledge is power, and action is preservation. Alright, let's dive into myth 10. And this is a really critical one because it involves something most of us have in our medicine cabinets. Over-the-counter pain relievers are harmless for your kidneys. Now, I know what you're thinking. A little ibuprofen for a headache or naproxen for muscle aches. What's the big deal? They're so easy to get. And yes, these non-steroidal anti-inflammatory drugs, or NSAIDs, can be effective for pain relief. But here's the crucial warning I need you to hear. They are absolutely not harmless for your kidneys, especially with regular, high-dose use, or if you already have underlying kidney issues you might not even know about. The way NSAIDs work can actually reduce blood flow to your kidneys. Think of it like this. Your kidneys need a steady, strong flow of blood to do their filtering job efficiently. NSAIDs can constrict the blood vessels leading to your kidneys, which over time, or with too much use, can lead to what we call acute kidney injury. This means your kidneys can suddenly struggle to filter waste, leading to a rapid decline in function. For someone with healthy kidneys, occasional use might be okay, but if you have a history of kidney disease, high blood pressure, heart failure, or are an older adult, the risk goes way up. My professional advice? Always use these medications sparingly. Read the labels carefully. And if you have any kidney concerns, or if you're taking them regularly, always consult your doctor or pharmacist about safer alternatives. Don't underestimate the power of seemingly innocent over-the-counter meds when it comes to your kidney health. Alright squad, after busting all those myths, it's time to bring it home with perhaps the most crucial takeaway: the importance of regular checkups and risk factor management. Look, because kidney disease is such a sneaky, silent operator. Remember, it often gives you no symptoms until significant damage has been done. Being proactive with your health is not just important, it's absolutely essential. You can't just wait for your body to send out a distress signal. That's why consistent medical checkups, especially if you have any of those risk factors we've discussed, are your first line of defense. So, what does that look like in practice? It means not skipping your annual physicals. It means having those simple yet incredibly powerful blood and urine tests done regularly. These are the tests that can actually show early signs of kidney issues long before you'd ever feel anything. Beyond just getting checked, it's about actively managing any underlying conditions. If you have high blood pressure, work with your doctor to keep it under control. If you have diabetes, prioritize keeping your blood sugar level stable. And of course, foundational healthy habits like maintaining a healthy weight, eating a balanced diet, and absolutely avoiding smoking are not just general health tips. They are critical kidney protective strategies. Your kidneys are working tirelessly for you, 24/7. It's time to return the favor by staying informed and staying on top of your health. Alright, my health warriors, we've reached the final myth-busting point, and it's perhaps the most empowering one. Conclusion: empowering yourself through knowledge. We've covered a lot today, from the silent nature of kidney disease to debunking those dangerous misconceptions about water intake, supplements, and even what kidney stones mean. The truth is, misinformation about kidney health isn't just innocent. It can lead to devastating consequences by delaying crucial diagnoses and treatments. That's why, my friends, understanding the real nature of kidney disease and its risk factors isn't just smart. It's absolutely vital for your long-term well-being. By equipping yourselves with this accurate, evidence-based information, you're now in a much stronger position. You can make informed decisions about your diet and lifestyle. You'll know when to seek timely medical advice instead of waiting for glaring symptoms. And you can take proactive steps to truly protect these incredible, hard-working organs. Your kidneys are little powerhouses, filtering your blood 24/7, removing waste, and keeping your body in balance. They work tirelessly for you every single day. So let's make a pact. Let's return the favor by staying vigilant, staying informed, and prioritizing their health. Keep learning, keep asking questions, and keep living your healthiest life. You've got this.